I rise with a call to my colleagues here to avoid a bait-and-switch decision that we're going to be faced with in the upcoming weeks. And I'd just like to harken back to June 6, 2009, when President Obama unleashed his plan for a government-run healthcare system that would lower costs, improve quality and coverage, and also protect consumer choice. Today, as a direct result of the passage of what is commonly known as Obamacare, we are seeing more taxes taken out of our middle-class paychecks and the prospect of skyrocketing insurance premiums in 2014. We are seeing that quality is decreasing as access to care for which you are eligible becomes a function of your age and political affiliations, not your needs. We are seeing that the administration's idea of consumer choice is really a case of my way or the highway. 1,231 organizations have successfully applied for waivers to Obamacare and thereby established a privileged class of 613,625 Americans. Clearly, there are many people concerned about this legislation. Against this backdrop, we have a federal government that has failed to pass a budget for over 4 years. Their continuing budget resolutions feature trillion-dollar deficit after trillion-dollar deficit. Now I ask you, why is the federal government having such difficulty balancing their budgets? Federal political dysfunction aside, the plain truth of the matter is that entitlement spending is spiraling out of control. In contrast, our state government has not only passed our budget 4 months early in the past 2 years, we have also made sure it was balanced, paid down debt, and put aside funds for a rainy day. The governor and my fellow legislators have worked hard to restore a measure of fiscal stability in our state to protect our youth from an unbearable financial burden. And now, our great state of Michigan is being told by the federal government to hitch their ride on their road to serfdom. Yes, Obamacare is indeed the law of the land, and I took an oath to support the U.S. Constitution and the Supremacy Clause found in Article 6. I will indeed honor that oath, but I will not do so blindly. In addition to continued advocacy for the repeal of this anti-American legislation, we need to make sure that we push the envelope of compliance in favor of the citizens of Michigan. Yes, we need to lower the cost of health care. Yes, we need to improve the quality and coverage. Yes, we need to protect consumer choice. Clearly, the Obamacare blueprint strikes out on all three goals. Thankfully, there are simple solutions that do accomplish these laudable goals with simple modifications of federal regulation. These solutions all revolve around a return to the most basic of American principles: freedom. The first of these solutions is to simply allow the free market to participate. Keep the government focused on government safety net programs such as Medicaid and Medicare, and let the private sector provide health care services outside of the shackles of a government-run exchange. Allow multiple private sector exchanges to connect with government systems that determine eligibility for government assistance for their customers. Competition will drive down prices, improve quality, and provide more consumer choice. The second of these solutions is to stop the federal government from telling us what kind of health care we must have. Every state already has a unique set of insurance coverage mandates. We don't need the federal government piling on with national mandates. We need to remove the federal regulatory authority to define essential benefits when it comes to health insurance. In addition to driving up health care costs, this regulatory authority has resulted in objectionable infringements of religious liberty. As of January 31, 2013, 25 other states have said no to state-based exchanges. Much has been made of states being granted the opportunity to create their own exchanges. What citizens need to know is that while these exchanges might be created by the states or even operated by the states, they are not, I repeat, not controlled by the states. The federal government makes all the rules. The federal government is playing entitlement hot potato with the citizens of Michigan and with all the states of the United States. And they're playing this hot potato in regards to your health and your wealth. They are now attempting to pass their hot potato of debt and out-of-control spending to the hardworking citizens of Michigan. We need to avoid the bait and switch, my friends. We need to stop the implementation of the Obamacare health exchange.